COVID-19 ay panibagong kontrabida sa buhay nating mga Pilipino.
Habang unti-unti tayong bumabangon muli, patuloy ang laban natin dito.
Para matalo natin ang kontrabida, we can be the solution.
Kaya mong maging bida, basta susundin ito.
B. Bawal walang mask.
I. Sanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA Solusyon sa COVID-19.
Cue in, Mr. Shell.
Maayong hapon sa tanan ng mga followers nato sa Facebook pages of the Philippine Information Agency and the Department of Health Central Visayas. Maayong hapon na natong tanan and welcome to another episode sa ato ang weekly nga virtual presser with the Department of Health Central Visayas. Ang ato ang BIDA Solusyon nga virtual presser, and we have with us ato ang mga guests nga gikan sa Department of Health Region 7 mo join sa ato ang karon panel kay mohatag og updates kabahin sa of course atong COVID-19 nga sitwasyon dinhi sa Region 7 ug ato pong pagahisgutan karong hapuna ang ato ang observance of the National Disaster Resilience Month for the month of July. So today is July 22 on a Wednesday. Kini si Rachel Nesha gikan sa Philippine Information Agency nga mo'y moderate sa ato ang pag-discussion karong hapuna. And before we start the ato ang discussion, ako ang ipaila-ila una, of course, ang atong panelist, una natong resource person for this afternoon, ang ato ng suki gikan sa Department of Health, kanunay na natong makita every week. Ang ato ang spokesperson on COVID-19 for DOH Central Visayas, ug atong chief pathologist as well, si Dr. Mary Jean Loreche. Maayong hapon, Doc, and welcome again sa weekly presser.
Hi, Ma'am Rach. Hi. Hi, everyone. So we are always happy to be invited so we can give you updates on what's going on with our cases and also the different and various programs of the Department of Health.
Yes, Doc. Later on, Doc, ikaw akong unahon unya og interview to give us mga basig na good news later on nga mahatag ka, Doc, regarding COVID-19 dinhi sa atong region. And joining Dr. Loreche, of course, ato pong suki usa sa atong mga suki gikan sa DOH, kanunay na natong resource person, ang atong medical program coordinator for DOH Central Visayas, si Dr. Shelby Blanco. Maayong hapon, Doc. Nice to see you again, Doc Shelby.
Hello, mayong hapon sa tanan.
Yes, si Doc Shelby mo ay muhatag sa ato karon og mga detalye regarding National Disaster Resilience Month niya. Ato'y pangutanaon niya ni Doc Shelby og unsaon nato pag-observe from the end of DOH in kining observation sa disaster resilience nga naamantay pandemic nga nahitabo karon. But before that, I'd like to ask ato ang spokesperson for DOH Central Visayas, si Dr. Loreche. Doc, do you have any updates to give us regarding COVID-19, Doc? Especially since naghatag naman tong statement recently si Secretary Simatu regarding nga murag medyo okay na daw, better na ang sitwasyon karon niya. There's a possibility nga ma-downgrade later ang ato ang community quarantine dinhi sa Cebu especially. Sige, Doc.
Good afternoon everyone again. So yes, I believe na kuan murag diha ta padulong no kung magpadayon kita sa ato ang mga numbers karon no nga giatubang nato. So apparently there is really more of an improvement comparing to the past 2-3 months no nga atong gisagubang ang COVID-19. Ug mamatikdan pud nato nga kaniadto ang ingon nila kita mura og mudungan kita sa NCR in terms of number of cases. But today I believe na dili na kita kaayo na ana nga number no. So I'd like to tackle on so sa Cebu lang yun, sa Cebu City, we noticed that our daily active new cases, dili na yun moabot o mga 150, 200 per day. So nagadula na lang na siya, ang pinakataas nga makita nato, na sa 150, kung taas na yun kayo na siya. But the past few days, it's been playing between 80, 90 new confirmed cases. So that's really something to look forward to. Also, I want to discuss about recoveries. Sometimes, Manggod, we get so focused and hyped up on the active cases, we have forgotten also about recoveries. Well, that can be a two-pronged approach, Ms. Rach, no? Usa, kung i-focus na to pag ayo ang ato ang recoveries, namang good tendency ang mga kababayan nato, no? And I believe this is part of us being Filipinos nga if taas kayong recovery rate, mura na dahil ibaliwala na nato si COVID-19. So, mura og mawala na dahil na ato minimum health standards. Tungod lagi kay kampante na dahil kaayta, di ba, Miss Rachel?
Yes,
pero another way of looking at it, Manggod, would be in a positive way. Meaning to say, kung taas ang atong recoveries, that means, and it can imply only number one, early treatment, no? Or the patient is seeking early help, no? Kaya dayon dali ra ang ihang recovery. Number two also is the capability of our healthcare system. Nga buti pasabot ana niya, we have ample doctors, we have ample supply of the PPEs, we have enough beds, no, for our patients. So that will actually be redounding to a better recovery for our mga symptomatic patients. Now, out of total cases na to, we're gonna talk about of 14,209. Ang atong recoveries is 6,473. That's approximately 40 to 45% of the total amount, no? And that's something very, very good. Pero we would really look forward pa nga atong recoveries will be even higher pag yun ani niya. Maybe if we can have a recovery of 70 to 80%, I think that would even be better for all of us. And of course, kanina namang number of deaths, no? Pirmi na ibalik-balik nga nganong taas gyud kayo ang atong death rate. Now, I look at it two ways. One, our reporting. So, kung we are really consistent with our reporting of the mortality rate or death rate, then we get the census correctly. Pero kung dili pud nato i-report, dili man pud nato makita, di ba? Number two, the death rate should always be seen two ways also. Number one, kada bitang aside sa reporting, ato siyang makita nga, are these really COVID-related deaths? Or are these the death of a different case or different type of disease, no? And number two, ato pong tanawon nga, a death report for the day does not mean nga namatay na sila ana kanang adlaw. So if you have around 50 or 100 that is reported for today, it does not mean nga kana sila tanan namatay karong adlaw, because there is a way by which the reports come in. So mo na siya, and I believe this is universal. This is not just our case here in Region 7 o kaya naman in the Philippines, whereby a death report doesn't really the day nga namatay ang pasyente, because it goes through a process also prior to the reporting. So I believe these are good news for us. These are some things na we can actually, that should encourage us. So I look at it this way, na kumbaga, with the encouraging numbers that we have, it should not lull us into complacency, but rather, it should encourage us to be more proactive, to be more aggressive in the implementation of the BIDA solution of the Department of Health.
Doc, that's where I'm ako personally, I'm happy to hear no nga mauna na siya karon ng ato ang sitwasyon improving, pero sama sa imong giingon ni emphasize gyud nato nga ang wala dili ta dapat magkampante ang publiko no, ang mga residente. Ako lang ipangutanan nimo Doc, how about it used to be mga Doc nga mahadlok ang mga tawo nga moadto sa hospitals amid no aning ato ang health scare. But karon with the COVID cases with kaning ato ang sitwasyon Doc, unsa may imong advice for those who want to seek medical care for maybe illnesses Doc or symptoms nga not related to COVID?
Okay. One of the improvements I believe that the hospitals are setting up is actually to separate their areas for COVID and non-COVID patients. So there should be no fear in going to the hospital. Siguro during the early months of the pandemic, nagsagol-sagol sila, no? So atong emergency room, diha ang musulod ang COVID and non-COVID nato. But today, I believe if we go around the various hospitals, whether it be government or private, particularly sa private nato, they have already separated areas whereby patients can really feel better knowing na they are non-COVID, so they go to a non-COVID area. But there is something na I want also to, inform our people, Miss Rach, no? One is that we have to always think na everyone has COVID. Kasi kung mamangguda atong mind setting that everybody has COVID, then we will not be stigmatizing, no, the people who has it. Kasi at the end of the day, you never know you have it also unless you get tested. That's one. So, number two, by thinking that everybody has COVID, including ourselves, then we are more proactive also in being able to implement the necessary health measures.
Oh, yes, Doc, kabalo ko Doc no nga you'll be hurrying to go to another appointment after this. But before we let you go, Doc, katuno maayo kaayo, that's good news nga nahatag sa atuan ni Doc Loreche regarding atong sitwasyon no sa COVID-19. But siguro Doc, I'd like to ask you lang with the statement ni Secretary, like I said earlier no, sa Mato nga naanay improvement, it could be downgraded to a lesser community quarantine in the next NATO round of assessment, especially for Cebu City, kay diri man ang hotspot. Doc, naunsa man ni katinuod nga ug mo downgrade ang community quarantine, ma-downgrade basta ang atong mga health safety protocols, kay I think adunay paghunahuna ang uban nga di na kinahanglan no nga maging ingana ka vigilant sila once mo downgrade na ang ato ang quarantine levels.
I like your word, Miss Rach, vigilance. Okay, so I believe that when we do downgrade, when we are really looking forward to it, no, because at the end of the day, it's a balance between health and economy, and we keep hearing that, no. And I am also a believer of that. The Department of Health also believes in that, no. So it doesn't mean that if we do go into a downgrading, that we should be neglecting already the minimum health standards. Kaya nga, we have the BIDA Solusyon project and program of the DOH, no? Ano lang bang ibig sabihin nito? Bawal ang hindi mag-mask, no? Kailangan isanitize ang ating mga kamay. Dumistansya ng 6 feet or mga 1 to 2 meters. Pangatlo is getting the correct information, no, to the right agencies. So, ito be the solution natin, and it should stay with us no matter our status, even if we go to the new normal already, and that is where we really want to go. We have to keep on doing what we're doing. So stay at home if you have nothing to do. So huwag mo nang pag-gala-gala dyan, or kung gagala-gala man at mahalaga yung lakad mo, keep the distance, wear the mask, kailangan mag-sanitize ng mga kamay. So, I believe these are all things na we need to be able to do. Now, may I also, isumpay ko na lang, Miss Rachel, no? We do have good news also. Kasi another good news is, people are more responsive now to the voluntary blood donation program of the Department of Health. As a matter of fact, the past 10 days, no, we have been doing our aggressive blood donation drive. So kahit papaano, we do have people who are voluntarily going to the donation, to the blood donation areas, no, nga among gina-schedule. So we are very happy nga atong mga LGUs, mga kapitan, atong mga mayor, and ang atong mga katawhan are really opening up again their hearts and their places, no, so we can have blood donation drive. So sa ngayon, when I had around 2 weeks ago, I know I was quoted as saying, no, wala talaga tayong dugo sa id na sa id. Now I am saying na we do have supply now, but then I would want to reach the 1.1%, no, of the target population na meron tayo para masabi ko talaga na if I reach 1.1% na blood supply nga naa din na sa ato ang subnational, then I would really say nga, tinuod na gyud nga ample ang akong supply. Secondly, we also want to inform everybody na convalescent plasma is available in our subnational blood center. No, so we have right now quite a number of the various blood types, no, for the convalescent plasma. So it is available not just for those who can afford, but even those who cannot afford, kasi this is free for everybody, no? Naalantay guidelines on how you can access this convalescent plasma.
Thank you, Doc. Nya siguro, Doc Loreche, for next week, no? Hopefully, naapatay much better na nga mga balita na pod, no? Ang mahatag natong nga update regarding COVID-19 cases. So, Doc, atong spokesperson for COVID-19 from the DOH Central Visayas, Dr. Mary Jean Loreche. Thank you so much, Doc, for sharing with us updates on COVID-19. Daghang salamat, Doc. And
Thank you, Ms. Rachel. Thank you.
See you again next week, Doc.
Yeah, see you next week.
Yes, so karon at this time we will be moving on to our second topic, no nga, because July is served as the National Disaster Resilience Month. Unya usa sa mga lead agencies nga nag-spearhead sa observation ani, of course, ang kanunay, no, nga frontline agency ang Department of Health regarding aning mga disasters, calamities, no, hazards. Nadugangan na karon na ato ang mga hazards nga giatubang, ang threats that we are facing, especially karon, no, nga ang kaning health, mga pandemic, no, health threats ato ang giatubang. So atong pangutan-on ato ang Medical Program Coordinator for DOH Central Visayas, si Dr. Shelby Blanco, for updates on the observation of National Disaster Resilience Month, especially from the Department of Health nga side, kay daghan mga agencies ang involved in the observation. Doc Shelby, hello! Maying hapon,
Yes,
Doc.
maying hapon, Ma'am Rach, and sa atong mga other media personnel, no? So, well, before we begin, no, for so long a time ang atong mga gipang tackle or gipang prepare good is, especially every time nga natay every July is more on typhoons, earthquakes, and this time around sa giingon pa nimo, Ma'am Rach, nga natay bag-ong threat, and this is more of sa outbreak and sa pandemic this time around. So mao na nga, that leads us to karon sa July nga celebration nato. Actually, this started June 28, 2017, no, through Executive Order 2029. So kaning National Disaster Resilience Month, and if we can remember, before it's National Disaster Awareness Month lang na siya, but tinaagi sa Executive Order number 29, so gi-change na into disaster resilience. And true enough, it's ang pag-change niya, it's aptly changed kay tungod karon daghan na gid na sinati nga mga kuan mga trahedya or pandemics, outbreaks, and disasters and emergencies, no? So mo na nga gi-observe ni nato karon through conduct of activities relative to the building of disaster resilience, no, with kuan gyapon subay sa 4 thematic areas sa national disaster preparedness plan. So mao to natay prevention and mitigation, part of the 4 thematic areas, natay preparedness, natay response, and natay katoy kaupat rehabilitation and recovery. So kaning thematic areas, well, previously nagkandak man tag mga disaster risk reduction management in health planning workshops, and diri makita na to how prepared are the mga LGUs in disaster through in ilang mga plans no sa disaster resilience mitigation, preparedness, response, and recovery. So again, this would reiterate importance of understanding the disaster risk. Una, dapat kabaluta sa disaster risk na to. Ikaduha, strengthening disaster governance. So that would entail pamalakad no so sa disaster governance. And then investing in disaster risk reduction for resilience. So dapat makita yun na sa atong budget side and enhancing preparedness for effective response. So pinagi sa atong mga plans side. And ikaupat would be implementing the Build Back Better sa atong rehab and recovery. So again, the theme for this year sa National Disaster Resilience Month would be sama-samang pagsulong tungo sa katatagan sa gitna ng bagong normal. And this would highly reiterate what we are going through right now, no? So sa atong outbreak, sa atong pandemic, sa COVID-19 nga response na to. So this again would focus on strengthening disaster resilience specifically in every community while adapting towards the new normal, no? So naantay gipangkuan nga mga minimum health standards towards new normal caused by the COVID-19 pandemic. So mao na siya, Ma'am Rach. And currently, what we have is gipadayon gihapon nato atong mga response no nga activities, coordination with LGUs, and last Friday nagkandak sad ta national nga nationwide nga CPR campaign through a webinar. So this is quite challenging kay tungod it's skill and demonstration, but we were able to pull it through gyapon. Yes, Ma'am Rich.
Doc Shelby. Yes, Doc, that was my next question, no? With the importante kaayong observation aning National Disaster Resilience Month niya. Doc, with the new normal, naay pandemic, how are we going to observe from, especially sa health no sector, saan pag-observe na to ani Doc sa ato ang mga activities na di man allowed ang mga mass gatherings pa karon?
Yes, well, ato sang gi-enhance karon through mga modular online trainings or giving of technical assistance through mga kuha na lang yun, web conferences. So this week alone, in coordination with OCD and Office of Civil Defense and DOH Central Office, natay gi-conduct nga incident command system training sa its executive course sa for those nga need to undergo overview or orientations, especially nga appeal sila sa response na to and incident management teams. So kana yun no, and kadto sad, as I've said, katong last Friday we conducted a cardiopulmonary resuscitation training pinagi sa webinar, and moton gipakita na to dito ang proper nga pag CPR sad.
Kato inyong CPR trainings, Doc, nga webinar, pwede ba ni siya per request sa kada, like kung naay sector sa offices ba karon or mga agencies, can they request DOH nga mo hatag ini nga klase nga CPR training?
Yes, currently kato in observation sa atong National CPR Day, mo atong nagkandak ta atong nationwide nga CPR cardiopulmonary resuscitation demonstration, but currently karon atong face-to-face nga interactive nga CPR training, it's put on hold, but gi-fixad nato nga we can conduct no towards adaptation of new normal gihapon nga mag-conduct ta og online training na sa CPR. But currently we are developing that. So hope for the meantime, for the time being, i-hold lang sa but as soon as ma-fix na nato and ma-hanay na nato ang module, then hopefully we can go through the requests sa mga tagsa-tagsa nga mga companies or facilities na gusto magpa-train for BLS CPR.
Yes, Doc. Okay, murag karon no, especially nga na hitabo lagi ning coronavirus, COVID-19 na to, Doc. Na-emphasize gyud kaayo ang resilience na kinahanglan no, ang need nga ma-resilient ang atong communities. Pero Doc, on your end, no, for your part, especially na hisgutan nimo ganiha ang disaster governance. So meaning dako kay role lang atong mga local government units when it comes to disaster and response. Kining sa pagsugod pa lang, Doc, sa atong pandemic, and I think siguro past experiences sab nato dinhi sa Central Visayas no nga when it comes to disaster response sa calamities no, mga natural hazards. So far, Doc, unsa may mga challenges nga giatubang sa ato dinhi locally when it comes to disaster, making ourselves kanang resilient, Doc, against disasters?
In terms of disasters, emergencies, mga natural calamities, mga technological disasters, let's say mga sea mishaps, we've been through that. And so far na lampasan man nato no, but this time around, since it's novel and the virus is novel and bag-o gyud siya, so mo na nga it's quite a challenge for LGUs and likewise sa Department of Health mo na nga there's a series of meetings, there's a series of collaborative efforts no para mabatok gyud nato ang maong virus. And of course mo na nga this is not just for this LGU or kaning LGU, but it entails everyone's cooperation. So not just sa mga LGUs, but of course it also would need the cooperation, especially sa tagsa-tagsa nato no, so down to the community.
Kana, Doc, no, katong imong giingon, down to the communities, dapat ang level, grassroots gyud no, ang magsugod ang atong disaster resiliency. Katong for the yes, Doc, for the benefit of those who are watching us karon, Doc, how can they make themselves, individuals, Doc, na kanang naa sa mga panimay, no, how can they make themselves be resilient, Doc, no, or be prepared and responsive sa mga disasters?
In adaptation, in adapting the new normals, no, it's very important ato ning ibalik-balik, and we've been emphasizing and reiterating this. We are currently into a 3-tier approach, you know. So first would be ang mga as we say, ang mga frontliners yun is kita yun, tagsa-tagsa, the individual person, kita mismo nga nasa community, kita ang mga frontliners, atong family members, they are still considered frontliners because sa ato man magikan ang safety nato. So if we protect ourselves, we wear masks, practice physical distancing, we wash our hands often and as needed, and other health protocols i-follow nato, dili ta magahig ulo, then ma-prevent nato nga makakuha ta og virus, ma-prevent nato nga maka-transmit, makakuha ta og COVID-19, no. So in that way dili sa ta magwas-gawas, so maka-prevent sad ta nga dili ta maka-pass on sa other mga tao or sa mismo sa atong family members, and by that alone na prevent na nato ang one transmission. And then second would be sa community na, no, so pre-hospital. So mo na nga natay mga barangay officials, natay mga barangay health emergency response teams to act on mga sa monitoring and sa lockdown to check sa proper implementation sa atong mga protocols. So mo na siya atong second nga approach, and the third would be katulad yung sa hospitals. And if we are to note, no, tulo na siya 3-tier, and kanang sa hospital, it's just the last frontier na yun siya. So mo na siya nga, if we can prevent overwhelmed health care workers, overburdened nga health facilities, if we do kaning duha ka first two nga steps nato, no? So, and that would greatly improve our response likewise sa kaning pandemic.
Dr. Doc, no? And while we have you, Doc, I'd like to take this opportunity also, siguro another round of reminders for the public. It's rainy season, Doc. Yeah.
Yes.
Along with that, mong dayon na atay mga dengue cases, no? Nya, nagpadayon sab nga na ay dengue cases gihapon nga ma-report dinhi sa ato ang region. So, with the safety protocols nga imong gi-mention, Doc, unsa may lain dapat, no? Kanunay gihapon nilang i-apply on top of the katong health and safety protocols for against COVID-19, ang katupong health and safety protocols against dengue.
Now, aside from the fact nga kaning COVID-19 magpabilin pa na until karon, so dili sa nato malimtan nga nasa tay mga other diseases, no, nga dapat tan-awon sa nato. And as you said, Ma'am Rich, nga naatay it's rainy season, and it's more on managhan ang lamok, managhan ang dengue cases nato. So mao na nga dapat i-reiterate sa nato sa atong mga communities, in kaning mga sa ato sa mga health officials, sa health authorities, sa tagsa-tagsa ka mga LGUs nga to look into atong mga dengue cases, dili gyapon yun pasagdan og other mga diseases, no, not just dengue nga. But in fact, we are also monitoring other mga viral diseases nga dili sad mapasangdan. So mo na nga, for example, sa dengue, dapat gyapon we follow mga health measures, no, preventive measures like katong 4S gyapon nato. So if we are to take note, daghan na tagbantayan kung seeking early consultation lang daan, aside from magbantay ta, giubuta, gilantan ta kay tungod basin makakuha tag COVID, but fever can also be a symptom for dengue, no? So mo na nga, we also have to monitor, and if makasinati ta og 2 to 3 days nga fever na, then we might as well seek early consultation para ma-assess, no, sa atong doktor or sa healthcare personnel nga nasa atong tagsa-tagsa ka mga LGUs kung dengue ba na siya or COVID ba or any disease that can be pwede maka-cause sa ilanat, no? And then of course seek early consultation, and then search and destroy, no, very important, no. Tan-aw gyapon ta sa atong palibot, doesn't mean nga magstay ta sa balay ato na sa pasagdan atong palibot, ang kalimpyo sa atong palibot, no. So mo na nga, we also have to look into our pagpanglimpyo, no. So dapat karon kiting uwan naman, so as much as possible we look into atong palibot lang sa natara nato, kung naabay mga water nga na stagnant diha, then that itself can also prevent, no, kada breeding sites for mosquitoes. And if walay, as we always emphasize nga, kung walay lamok, wala gyud dengue. So and search and destroy, and of course katong constant change of our flower bases, kaning putting cover sa atong mga water receptacles kana, no. And third would be sa 4S gyapon would be protecting ourselves, no. So wearing of protective clothing to prevent ng pakantag lamok, no. So and of course at this point, if nahimo na nato to ang tulo ka S nato, then the last S would be katong misting or fogging, if needed, would be prevented na sad, no. But of course, part yapon siya sa 4S. So again, mo na siya Ma'am Rich ang sa dengue sad. And for other, of course, no, we also have to look into mga karon nga naka-quarantine ta, karon staying at home ta, nagatan-aw ra tag TV, we are like couch potatoes, so nya munching, binging on food, so pa-deliver, so mo sa natong kuan nga at least pastingot lang sa gamay, and then para dili mo dako atong tiyan or manambok, no. So and we also have to look after our health sa weight nato, so kana sa mga important nga points nato for those nga naa sa mga tatagsa nila kapanimalay.
Sakto to Doc, no? Salamat sa mga reminders on the health and diet side kay murag I'm sure makarelate daghan ang makarelate ana Doc.
Daghan yun.
Usa na mi ana Doc. So Doc, hi. Thank you kaayo Doc, no, for the updates and the reminders, but I'd like to ask you karon Doc unsa may ato ang mga hangyo, especially Doc sa mga local government units, no, ato ang mga LGUs kay dako man gyud ang role nila when it comes to stopping, no, not only the spread of COVID-19 but also katong ubang mga health threats na giatubang nato karon, no. So Doc, to wrap up lang atong discussion, I'd like to ask you Doc for your closing statement.
Okay. Well, again, we can only do this with everyone's cooperation, with everyone's collaboration. So for the part of the LGUs, magtinabangay lang ta, no. It's not let's stop blaming each other, but we need to have a coordinated effort, no, para ma-calculate nato ang response, and that would improve likewise atong better outcome, no, in terms of this pandemic. And ikaduha, of course, we always have been in coordination with all the LGUs, no, so we are also calling them from time to time and visiting them, and we have our representatives, mga DMOs nato, DOH representatives nga andam sad mo hatag og assistance, no, to link DOH and the LGUs. And of course, we also would like to ask our government officials, no, nga to be one. It's very important. And of course, tagsa nato individual persons, tagsa katawhan dili sa tagsa ka community. It's very important that we cooperate and do, no, kung unsay giingon sa gimando sa DOH and likewise sa ato mga local officials, health and government officials. In that way, we can prevent this pandemic from going into greater proportions, and we can move on and hopefully adapt better new normal. And on the part of the DOH, of course, we have bago lang ni siya, we are currently formulating teams, no, gitawag na itong code teams, and this meaning code is coordinated operations to defeat epidemic, and we are gi-form ni siya to assess and likewise to help no mga LGUs nga in their response and further better our outcomes in terms of this COVID-19 pandemic.
Okay Doc, paapas lang Doc, katong core teams na form na sa diri sa ato sa region Doc, naa nataan ni?
Currently, it's ongoing, no? So bago lang ni siya gi-cascade yun namo. So mao ni ang tawag code team, CODE. So meaning is coordinated operations to defeat epidemics, no? So before coming here, the meeting is still ongoing, and mao ni siya na brief orientation on this one, no? So morning code coordinated operations to defeat epidemic teams, and this initiative would help augment, no, unsay mga panginahanglanon sa atong tagsa-tagsa ka mga LGUs, and in that way leading into better coordinated and calculated response for the pandemic.
Okay, thank you, Doc Shalbay.
Thank you, Ma'am Rach.
Yes, daghang salamat no atong Medical Program Coordinator for DOH Central Visayas, Dr. Shelby Blanco. And earlier, we had with us atong Chief Pathologist and Spokesperson for COVID-19 for DOH Central Visayas, si Dr. Mary Jean Loreche. So sa ato ang mga viewers karon, hinaut-unta no, aduna mo'y nakuha, namoy napupo nga mga reminders and important advisories no gikan sa ato ang Department of Health nga mga officials, and sama sa ilahang gi-share ganiha dili gyud ni magmalampuson ning ato ang kampanya karon against COVID-19 and all the other nato nga mga health threats kung dili na mag-cooperate, no, if not without public cooperation. So for this week, we'd like to thank atong guests for joining us, and please join us again next week for another round of updates and public health advisories from the Department of Health Region 7 for our BIDA Solusyon Virtual Presser every Wednesday sa hapon no, live sa Facebook pages of the Department of Health Central Visayas ug Philippine Information Agency Region 7. In behalf sa amuang Regional Director sa PIA Region 7 na si Fayatinien, mayong hapon natong tanan, and we'll see you again next week.
Ang COVID-19 ay panibagong kontrabida sa buhay nating mga Pilipino.
Habang unti-unti tayong bumabangon muli, patuloy ang laban natin dito.
Para matalo natin ang kontrabida, we can beat the solusyon.
Kaya mong maging bida, basta susundin ito.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA Solusyon sa COVID-19.